A little more discussion about the upper cervical spine. It is the most challenging, technical and risk-wise, the most challenging things to work on, but oftentimes are also the most important things to work on in the cervical spine. These are often injured in car accidents with what's colloquially called as whiplash type injuries. And there can be up to even a centimeter, about that much abnormal translation of those vertebral bodies and joints on each other. That will lead generally to headaches and dizziness, changes in vision, a lot of neurologic symptoms along with a lot of pain, but also a lot of changes in how neurologically the spine holds itself together. There are 4 separate training programs in the chiropractic world that address only upper cervical instability. One of the things I've learned in my career is if there's a lot of ways to approach something and they all exist and they all have lots of patients, it works to some degree, and it's identifying a problem. I work with these practitioners to create a more full healing paradigm that would require less long-term care. The structures to be very, very cognizant of that need to be treated in the upper cervical spine are the joint that's between the head and the neck. That's the atlanto-occipital joint. The next joint, which is the atlanto-axial joint. The ligaments that hold those together in the back, that's supraspinous, interspinous, and also the intercapsular ligaments, the ones that go between the joints. I know these are a lot of technical terms, but all of these things need to be treated together. There's also a structure called the atlanto-occipital membrane, very important stabilizing structure. And all of these require ultrasound together with fluoroscopy to do them safely. There's also a ligament that wraps around a projection from your second vertebra called the odontoid process, sticks up in the like this with the atlas or the first vertebra surrounding it. So this is where a lot of your rotation comes from. There's a ligament called the transverse ligament that holds that in place. That ligament can be injected. The ligament that's actually right behind the spinal cord, called the ligamentum flavum, can also be injected. But again, all of these need to be done with ultrasound and fluoroscopic guidance combined, and contrast to ensure that you're not inside of blood vessels and are not going to injure the vascular supply to the brain. This may sound scary to you, but the understanding the deep anatomy, the deep dysfunctions, the deep injuries, how to assess them and then how to treat them and then how to rehabilitate them is the core of how somebody heals from their neck problems. When upper cervical components are involved, all these pieces need to be coordinated and collaborated with very deeply and very carefully.